This is the left kidney. We can see in the hilum there is a vein. This vein is left renal vein. Okay, just posterior to that is the artery. That is left renal artery. And descending down from the hilum is the pelvis of ureter. It's wider here and it's narrowing here. You can see that. That is pelvis of ureter. So the structures in the hilum of the left kidney are renal vein, renal artery and ureter. The point to note here is the left renal vein is receiving two other veins. You can see one vein from here going like this. There is a left gonadal vein, and you can see one vein coming from the suprarenal gland, left suprarenal gland. This left renal vein is longer in length and receives two additional veins, the left gonadal vein from the inferior aspect and left suprarenal vein from the superior aspect. The left renal vein is longer than the right renal vein. It has to cross the front of this tube. This is abdominal aorta. Okay, it is crossing anterior to the abdominal aorta. This shows embryological development of the left renal vein is from the two subcardinal veins. There is a ventral anastomotic channel that is persistent as left renal vein. So that is the details of left renal vein, why it receives additional vein. That is the left testicular vein and the left gonadal vein. In this kidney also we have an extra blood vessel. If you note it here clearly, I'll show you this one. It's an additional artery. It's called as accessory renal artery. So what happens during development, the kidney which is present in the lower aspect of the body develops from the metanephros, specifically speaking at the lumbosacral region. Kidney develops from the metanephric blastemal cells. This metanephric blastemal cells initially forms the Bowman's capsule, subsequently the PCT, then the loop of LA, DCT, and then the collecting tubule. So during the collecting tubule portion, one bud will grow towards the developing kidney. That bud is called as ureteric bud. It is developed from the lower part of the mesonephric duct. This ureteric bud pushes the kidney upwards, first from the pelvic area into the left and right iliac fossas respectively, then into the present region called the lumbar region. It will push the ureteric bud developed from the mesonephric duct, pushes the developing metanephric kidney from the pelvic area into the present lumbar area. So in simple terms, kidney ascends upwards from the pelvis into the abdominal cavity to be located in the lumbar region. During this time, what happens? The kidney which was receiving the blood supply, okay, the kidney, this is the kidney, it was receiving the blood supply from the common iliac vessels, okay. It was receiving blood supply from the common iliac vessels, internal iliac vessels initially, then common iliac, then common iliac, then lowermost part of abdominal like this, okay, then here at the level of L3 vertebra, then it comes at the level of L2 vertebra. So what did you understand? During the ascent of the kidney, the blood supply, the blood vessels shuffled from the internal iliac, common iliac, lower part of abdominal aorta to the middle of abdominal aorta. So these, the appearance of a new artery makes its appearance, okay. The older artery should disappear. The previous artery should disappear because kidney ascended upwards now. But if at all there is a persistence, of the lower renal arteries which were developmentally during the ascent of kidney, which was there from the lower part of abdominal aorta, it is called as accessory renal artery. Accessory means extra renal artery. So this kidney has got an extra blood supply, accessory renal artery. So the surgeon should be aware of such extra artery so that inadvertent damage of the kidney is prevented and renal transplant can be done successfully, and any dialytic procedure can also be done successfully. Thank you for watching and learning from Logic Medico. Kindly press the thumbs up icon and share this video with your other friends. Thank you once again.